Immunizations for adults. And because I think, and even when I started at the health department, I started in public health back in 2000. It was when I started District Health Department number 4 here in Alpena, as well as the health department in Northwest Michigan, which is kind of northwest side. And then they added in Benzie-Leelanau Health Department too, the kind of the little finger of the lower peninsula. But most of what we did immunization wise were for kids, all the baby shots, the kindergarten shots, and we weren't really giving, adults got, like flu and pneumonia and a tetanus every 10 years, and that was about it. But there's lots of different immunizations now for adults, and the whole vaccine schedule has really gotten a lot more crowded, which is a good thing because we protect against a whole lot more vaccine preventable diseases than we used to. So this one is really just about vaccines for adults, the kind of routine immunizations to think about, risk-based, meaning people with certain medical conditions need some vaccines that healthy people don't. And then if we have time or you have questions, we can talk about, vaccines you might need for travel and how to approach those sorts of questions that you might have if you're doing especially international travel or travel to developing countries. So first off, public health in general, a big part of what we do in public health, your health department, which in Michigan, health departments, the state of Michigan, the Constitution in the state of Michigan basically said that public health is a primary concern to the government of the state of Michigan. And in the Constitution of our state and in our laws, they basically said public health, provision of public health services is the county's responsibility. So the state said, counties, you shall, not can, but shall do public health. And then they also allowed back in the 1930s the provision of district health departments. So you have smaller counties, rural counties, rather than all going at it themselves, they could be more efficient and have a district health department. So that's why this is District 4. They used to be all broken up and numbered. And that's, if you don't know, Sheboygan, Montmorency, Presque and Alpena County. The kind of headquarters, the administration is in Alpena because I don't know, that's what they chose. It's the biggest city here. And District 4 is who shall provide those public health services, which you probably think of as like getting your water tested, septic systems approved, wells, food inspections at restaurants, and then, the nursing services, immunizations, hearing and vision, communicable disease control, all of those different things that we do, the kind of two basic nursing and sanitation sort of things. And public health in the 20th century was responsible by far for the largest increase in longevity in the 20th century. Nearly 20 years of extra life was due to public health, which primarily was number one, the biggest thing was sanitation, having clean drinking water and safely getting rid of your waste in a way that it didn't contaminate your food or drinking water, really was a big thing. And then the number two thing, control of communicable diseases through immunizations, antibiotics, as well as controlling outbreaks through the old tried and true public health interventions that we used to think were a time of the past, but now you probably are, more familiar with the terms isolation and quarantine and incubation periods and contagiousness and all of those things. So back in 1917, before the influenza pandemic that occurred at the beginning of the century, the leading causes of death, heart disease, pneumonia and influenza were number 2. Tuberculosis was 3rd. Things we think about, kidney disease, stroke, cancers, accidents. These were also infectious diseases. Syphilis was 10th. In 2019, before the last pandemic, the infectious disease all the way had to go down to number 9 to see influenza and pneumonia there. Again, primarily affecting older adults or adults who have underlying health conditions. In 2018, influenza and pneumonia was number 8. It varies, as you know, flu seasons, we have mild seasons, we have severe seasons, we have middle of the road seasons. Anywhere from 20 to 50,000 Americans die from flu every year. And again, although children can, and it's tragic when anyone dies from the flu, but it's primarily older adults. In 2021, COVID was the third leading cause of death. So we do have, changes in that, but primarily to a large extent because of vaccines and antibiotics, we've really removed, and better public health, we've taken infectious disease and moved it down the line as concerns. So it's really one of the major successes, I think, in the 20th century in modern medicine. It's one of the most important public health initiatives for sure. We've eliminated many childhood diseases. We've significantly reduced the incidence of many others. That saves billions of dollars in healthcare costs and lost time off from work, loss of income, et cetera, et cetera. Just to remind us all more, this is our, the annual morbidity and current morbidity from vaccine preventable diseases. And you can see, we've seen huge decreases. Smallpox has basically been eradicated. Diphtheria is eradicated in this country. Tetanus still occurs because people don't always get their tetanus boosters, but it's very rare. Polio, until just a few years ago, we had eliminated it from the Western Hemisphere, but there was a case, gentleman in New York, in the state of New York, who got polio. He was unvaccinated and had paralytic polio, which was kind of depressing to be going backwards like that. And you've heard about measles. We had an increase in measles. There's been 6 cases in Michigan this year, which mostly related to international travel, but with the fall of immunization rates, certainly something to be concerned about. But we're here to talk about adults, and I think that's the point. Most of those things I was looking at were kind of the childhood illnesses, and I bet many of you, if not all of you, had your childhood immunizations, but you're never too old to get vaccinated. These are all the different things that we offer protection against, that you can be protected against. Many of them, if you had chickenpox as a child, and I'm going to guess that most of us in this room, including me, had chickenpox. We don't need the chickenpox vaccine because we had the illness. I had the MMR vaccine. Perhaps some of you did, or perhaps some of you had measles, so you don't need protection from it anymore. But if you hadn't, you could. And then there's a whole lot of other vaccines in there that hopefully either you've had recently or you'll learn more about it today. It's not just flu shots anymore. So how do we determine what immunizations to recommend to people? Well, every year they come out with immunization schedules. They don't change that much. Usually they change the footnotes, or sometimes there's new products. Sometimes they tweak things. They look at new evidence and say, you know what, we're going to change who we recommend it for. It's approved by, and this is different, like a regular medication, an antibiotic, let's say, and the FDA approves that medication. It's now approved. If it's approved by them, it then goes out there, it's available, a doctor can prescribe it, the pharmacy will fill it, your insurance hopefully will pay for it. But that doctor can prescribe it. There's not necessarily like clear national recommendations about exactly who should get that medicine and when they should get it. Vaccines are different. Partly and mostly because vaccines are things you're not sick, you're feeling good. We're trying to keep you from getting sick. So you need a little bit more guidance and certainly a lot more safety. So every year, these schedules are looked at and approved by several groups of individuals. And there's really very little like that in healthcare, where you have national organizations that say, this is the schedule that people should get. A doctor, in theory, could give, from an FDA standpoint, could give any vaccine to anybody they want because it's FDA approved and the doctor is the doctor. But this gives them guidelines that they should follow. So vaccines are approved by the Vaccine and Related Biologics, the VRBAC, which is like an advisory committee to the FDA. They're the ones that approve it for approval. Once the FDA says it's approved for use in this country, it then goes to the Advisory Committee on Immunization Practices, which is, people think it's the CDC. It is. The CDC, they advise the CDC, but it's a group of individuals. It's scientists, it's doctors, it's infectious disease doctors, it's internal medicine doctors, it's lay people, it's people from universities, It's people from public health departments. It's experts in epidemiology and statistics. It's economists that look at cost effectiveness and look at it from that way. And they come together and they vote and either approve or not approve, recommending that vaccine for certain things. And it's not just the ACIP. These schedules now, when I say this is what's recommended to you, it's the ACIP, the CDC, but it's also the American Association of Family Doctors. So that's all of the family doctors, the National Association. It's the American College of Physicians, which is all the internists. Might be if it's something that it relates to pregnant women, it's going to be looked at by the Academy of Academy of Obstetrician Gynecologists, et cetera, et cetera. So it's really, you're looking at large, the groups that represent almost all of the doctors in some way or another, making these recommendations. Adult vaccines, different than kids, which is kind of age-based. Adults, there are ages where they recommend it for everyone, but traditionally it's based more on risk conditions, what sort of underlying health conditions or other conditions you may have, based on maybe your occupation or your travel, things like that. So we'll talk about now some of the specific vaccines, and I kind of grouped them. Seasonal respiratory infections. We all know, winter's the cough and cold and flu season. Things like influenza and RSV primarily are far more common. They kind of cause an epidemic every year that goes through either in the late fall or early winter. There's lots of other cold viruses. There's plenty of other respiratory viruses that circulate more in the winter when we're all together and indoors more with less open air and less ventilation. COVID is certainly a respiratory infection and has some seasonality. I think we're still learning. COVID, unfortunately, though, seems to think summer is also a perfectly reasonable time. And we tend to, we've been, the last month, there was definitely a bump in COVID activity up here and nationwide. Probably not as big as in the summer, but certainly has some seasonality to it. So the flu vaccine, we all know about that one. I'm not sure where that came from. Do you? But can you close that up? There you go. Thank you. Influenza vaccine, that's a simple one. All of us 6 months and older, pretty much everybody should get a flu vaccine every year, especially people who are at increased risk, which includes, adults over 65, people with underlying health conditions that weakens their body's ability to fight off respiratory viruses, or they have underlying lung problems, heart problems, diabetes, they're immune suppressed, things like that. But really everybody, and why do I recommend everyone 6 months and older get a flu shot every year? Because although I think even, I'm a healthy guy, if I get the flu, I think I'll get over it just fine. And if a child gets the flu, I'm going to tell that mom, it's the flu, they're going to have a high fever, you give them some Tylenol, they're going to get better, because they almost always do. But almost isn't the same as 100%. And I want to reduce, that's my job as a doctor, even if it's a low risk of having severe influenza, it's not no risk. And, I don't want my kid to suffer from influenza, and I don't want them to be part of that statistic. And I have gone to funerals of children who were perfectly healthy, running around, 7 years old, living in rural northern Michigan, and I've gone to their funerals from influenza. Why did they die from the flu? And most 7-year-olds don't die from the flu. I don't know. Why do some people win the lottery? I don't know either, right? But somebody has the winning ticket. This is not a winning ticket, but that's why I recommend the flu for everyone. But as you are older, it's more important. People ask about timing. Really, September, October is the best time to get it. Some people, if you were planning a big trip, and it's available in August, you might want to get it in August. I wouldn't wait much longer, because if you're getting it in September, October, it's going to protect you through the flu season. Sometimes it comes early, and you wouldn't want to wait to get it and then get the flu instead.
It's cold and flu season. Yeah. Get your flu shots.
Yeah. I love this. Was from 2000. This is from 2000. 16 or 17, I think. So before, when he couldn't win a football game, he at least, I don't know why, but someone asked him, someone was out with the flu or something. It was a press conference about football, but I'm a Michigan guy, and Coach Harbaugh was telling all the reporters out there to get your flu shot. And I'm like, good enough for Coach Harbaugh. I think that's a good message. And so I like to include that in there. People know about pneumonia vaccines. These are always confusing. The pneumococcal vaccine or pneumonia vaccine. It's been around a long time, but there's this one here, the polysaccharide, it's a mouthful, but that's the Pneumovax. That's been around when I started at the health department. Adults, everyone over 65 is supposed to get a pneumonia vaccine, a Pneumovax. But it's different. Flu, you're supposed to get every year. Pneumonia, you only needed once. And people would get confused. They'd try and get second and third pneumonia vaccines, but you only needed one. But now, and we've been using these conjugate vaccines, Prevnar, maybe you've seen an ad for that, or Pneumovance, a couple different brands now, like kind of Coke and Pepsi. But the conjugate vaccines are just a newer, we've been using conjugate vaccines with children for many years. They provide longer lasting protection. I think in many ways, better protection. It's just how your immune system responds to them. And we've used them for many years in children. We give pneumococcal conjugate vaccines routinely to kids, multiple doses, and we've really reduced the risk of pneumococcal meningitis. We saw less ear infections, far less pneumonias, less bacterial infections. And in fact, it changed the whole way we approach babies with fever because of this vaccine, because we were so fearful of this. And if the child's been vaccinated, we don't have to worry about it. But so with adults, now there's recommendations to use that as well. And again, it's a bacteria that can cause pneumonia or bloodstream infections. And can cause, often people get influenza that causes their lungs to get inflamed. They get secondary pneumonia. And that when you see that leading causes of death, that's influenza and pneumonia. That's what they're talking about. So it's pretty simple, the recommendations, but they're also really confusing, partly because they've changed them a lot as these new products have been approved for use in adults. So for pneumonia, the pneumonia vaccine, if you've never had one and you're 65 and older, you should get a dose of this newer conjugate vaccine. And then if you get the PCV20, you are done for life. If you had the old pneumonia vaccine, because I got the pneumonia vaccine because I have asthma, because they weren't recommending, they didn't have these for adults yet. So now I've had that, I can also get a PCV20 or 15, the conjugate vaccine, and then I'm done for life. Adults who are under 65 who have risk factors, they have asthma, they have lung disease, they have diabetes, they have congestive heart failure, they're smokers, maybe they're taking a medication that reduces their body's ability to fight infections, a medication, for cancer, or a medication for, arthritis or something like that. If they have liver disease, if they have cancers, they are at increased risk and they can get this shot earlier. But again, they just get the one dose. But it's confusing. It's a good one to talk to your doctor about. If you haven't ever had a pneumonia shot or you're not sure, I'm going to guess that most of us in this room could benefit from it. RSV vaccine, another respiratory vaccine. This is a new one. Who's heard of the RSV vaccine? Okay. Wow, a lot of you. So I must get out there. Is it like advertisements, or you just advertisements? Okay, yeah, advertisements. Yeah, they're good at that. So RSV, who had heard of RSV before the vaccine came out? Okay, one person. And did you think about it for adults or for kids? Kids, yeah, what? Cows? Oh, I didn't know cows could get RSV, but babies, yeah, I'm a pediatrician, and RSV every year would fill our hospital wards with babies with bronchitis, bronchiolitis, pneumonia from RSV. Certainly, a scary thing for new parents, especially if your child has underlying health conditions or prematurity, and very scary. But it also can cause a lot of morbidity and mortality in older individuals. especially if they have underlying conditions that make it hard for them with their breathing and their lungs. The vaccine, there's new medications and vaccines for babies, but also there's the RSV vaccine for adults. Because although it's a common cause of colds, we all get this. You don't get long-lasting immunity. You can get RSV. There's different strains. It's something that we all get, but as you get older, you're more at risk of having it go from an upper respiratory infection, sinus problems, colds, sore throats, to bronchitis and pneumonia, where your lungs can fill up with fluid and everything else. So, and this is one where the recommendations change. When it first came out, they said anyone, anyone 50 and older, talk to your doctor if this should be for you. And they were recommending kind of like anyone could get it. And now we've gone a year and they've given this to a lot. We have a lot more data about it. And what they're finding out is that really anyone 75 years of age and older can benefit from this vaccine. So instead of saying, well, think about it, the new recommendation is if you're 75 and older, you should get this vaccine based on the recommendations of all those groups. And that's basically age-based because although there are, and I bet I'm looking at some people over 75 who are very healthy, very active, they're still out there hitting golf balls or doing their gardening, and they are, are healthier than average. For the most part, as you age, your lung capacity starts going down and you're more likely to have other conditions like diabetes or emphysema or lung disease or heart disease, or you might more likely to be having medications that suppress your immune system, et cetera, et cetera. So that's where they came up with that. And then for people who are 65 to 74, they said only if you have some of those health conditions that increase your risk. If you're a healthy 65 to 74-year-old who, whatever, you're lucky, you take care of yourself, you don't have really any major health conditions, maybe you have high cholesterol or high blood pressure, but you control that with your medications, you really don't need this because you're unlikely to get that sick from it. And that's where they've really decided to really kind of limit it a little bit more than they did just based on newer data. And I think that's a good thing. This is a one-time dose. Yeah, so they don't recommend anymore. It's once in a lifetime. Will that change over time? It might, because we don't know in 10 years, what's your antibody? We don't know how long it lasts. So we know it's effective for several years, but I think we'll collect more data. And so maybe a booster will come out. This is not a conjugate vaccine. No, it is a different sort of vaccine. It's inactivated. It's not a live virus vaccine. So that's why if you're immunosuppressed, you can get this because it can't give you RSV. It's inactivated. But the vaccine has not changed. The recommendations changed a little bit. Yeah, because they've tightened it up and said, you know what, we have more data now, so we can make more specific recommendations. And I think that's how science should work, right? You should look at it and say, okay, do we need to change things? Do we need to expand it or restrict it so that we get, that we help the people who need it most and don't give things to people if they don't need it from a cost reason and a side effect reason. So I don't want a shot if I don't need it. Oh, well, that's good to hear. Yeah. Yeah.
And everybody around me crashed and burned with COVID. And I got my shots and I'm in really good health. I got that late, but other than that, and I never got it.
No.
And everybody else did. So I'm a believer in that.
Right. Well, I'm glad the health department was able to help you with what you needed. That's always good to hear. The LTCF, that's long-term care facility, and that's really when you're looking at people who are really frail, needing regular health care, whether they live at home and you have nurses coming to the home or loved ones taking care of them, or they're in a nursing home. That's really, and where RSV, where you're more likely to have outbreaks because you're in a facility like that, they really can benefit from this vaccine. COVID vaccine, we're not going to go long into depth, but COVID didn't go away. The pandemic went away. I think the big thing is that pretty much all of us have some underlying immunity because we were vaccinated, because we had COVID, because of both. So it's different now. We all have some immunity. So why would you keep getting the vaccine? And the idea being that if you get a booster, if you get another vaccine, especially one that's been updated to the new strains, it's going to add some protection to your ability to fight off this infection. So not that you won't get infected, but that if you do get infected, you get milder illness. So who's really important to get this? Again, the same kind of people who are at increased risk of severe respiratory diseases from all these other things. I think those are the ones where you really want to think about getting this vaccine, because although you already have some immunity, you're far less likely to get as sick as you would have perhaps, at the start of the pandemic. Your immunity does wane. You can get COVID again, and you still have elevated risk compared to most other people. Different than a young person who, may look at this and say, I've got immunity and I'm not as worried about it. But I say that, and some young people might say, but you know what, I still don't want to get COVID. And if I do, I don't want to, I'd rather only miss a few days of work than a week of work. And I take care of my mom, or I visit my aunt in the nursing home, and the last thing I want to do is give it to them. Or my wife's expecting a baby, or I have a grandbaby and I don't want to give it to them. And those are good reasons to get the vaccine as well. It's not 100%, but it's going to decrease risk. You had a question. Yep.
Well, I have Pfizer,
Mm-hmm.
and I found out last fall or last spring, I guess, that Pfizer is harder to keep, so they don't order as much of it. And I was wondering, is it possible if you had Pfizer all the time that you can switch to one of the other companies?
Yeah, that's a, yeah. Yeah. Oh, yeah. So you're asking about, you had one brand, the Pfizer brand, and can you switch? And when it first came out, they weren't sure. So they were like, you were supposed to stick with your brand. Once, like you had to be loyal to that brand. That is not the case anymore. Moderna and Pfizer and Novavax, which is a more traditional vaccine. It's made like a flu vaccine. It's not mRNA. The Moderna and Pfizer mRNAs, they've all, for adults, they've all been fully approved for use. They are FDA approved, and you can get any of them. So they're coming out with an updated one that'll be available probably sometime maybe the end of August even, or in the fall. Kind of think about when you're getting your flu shot, and you can get any of them. And the right one to get might be, if you have a preference, then ask and see if you can get that one. I don't have a preference. If your doctor or your pharmacy has one brand and you can get it today, that's a good one to get. I don't know that one is better. And if you had Pfizer, you can get Moderna. And if you had Moderna, you can get Pfizer. It doesn't matter anymore whatsoever. And whether are we going to see this every year? I don't know the answer to that, but I do know they're coming out with a new one, and the recommendations haven't been put out yet. But I would anticipate that there will be a newer variant COVID vaccine that can offer you additional protection if you want it, to get the same time you get your flu vaccine. No, I am not seeing any long-term side effects. No, I think there are individuals who got side effects from the vaccine, but usually if you see them, well, I guess here, let me put that back. If you see them, you generally see them within the first 6 weeks of getting the vaccine. Yeah. I've not seen any data that would suggest that it would increase your risk for Alzheimer's whatsoever. I think we still are learning a lot about long COVID, which, I think is clearly a real, disease. People poo-pooed it, but we're learning a lot more about long COVID from getting COVID infection. And I know, some people that have really suffered from that. I think we're seeing some data that, the vaccine might help reduce that risk, but I think we still have a lot to learn from that, quite a bit. So more on that. But shingles, who knows about shingles vaccine? Okay. I generally don't ask medical questions, but I'm assuming many people here probably got their shingles vaccine. I got my shingles vaccine. Do you know what shingles is? Yeah. What? Well, kind of. Do you know what it's from? Yeah, yeah, actually, I have it right on there for you, chicken vaccine. So this is a unique vaccine because other vaccines prevent disease. Well, you prevent, try to keep you from being infected and getting sick from something. This is a reactivation. It's trying to reduce your risk of having a reactivation. You already had chicken pox. And so when you get chicken pox as a child or whenever you get it, that virus becomes dormant in your dorsal root ganglia in your spinal cord. And it just kind of hangs out there and it doesn't bother you, but you don't ever fully get rid of it. And then sometimes for no reason at all, there's a risk that it can reactivate. But as you age, you have just aging, our immune systems start kind of going downhill after around age 40. Whether we like it or not, or want to admit it or not. And then certainly if you're stressed from you're fighting off another disease, you have a condition that you've been battling, you're taking medications for those things, you have cancer, anything that stresses your body and your immune system can cause that, can allow that chicken pox kind of to open up the door, and it comes out. And that's why it's in that nerve root, and that's why it generally follows those nerve root patterns. And you get these rashes that kind of follow what we call dermatomes. And the lifetime risk of getting shingles, herpes zoster, is about 1 in 3. As you get older, your risk goes up. It generally resolves, but can be really, really miserable while you do have it. About a little under 20% of people get what's called post-herpetic neuralgia. I don't know if anyone's had that. I've had a neighbor who had it, and it can be very, very painful. It can take months to go away. So that's shingles. And the shingles vaccine, there's been a couple different ones, but the one now, the only one that we use in this country is Shingrix. It's a recombinant vaccine. It's not a live virus. So people who are immune suppressed can get it. And again, it doesn't prevent infection. It reduces your risk of reactivation. Very, very effective. Anyone now, the routine recommendation here is 50 and over. You get 2 doses, 6 months apart, and that's it. They don't recommend boosters or anything else. Could they, as people live longer, healthier lives, they might find that it that it wanes over time, but it's worked so well that at least up to this point, they haven't seen any reason that you would need a booster at this point. Oh, the shingles vaccine. Yeah, I should mention that. You feel miserable when you get one. People talk about like they were hit like a bus or whatnot. I mean, the COVID vaccine made you feel kind of miserable, at least I did, but shingles was far worse. And it's a couple days of, you can have fever and chills, just a lot of fatigue, muscle aches, just feeling miserable, because what it's doing is it is ramping up your immune system. And when your immune system gets ramped up, that's what causes aches and chills and fevers and things like that. So people take a day off of work and things like that. Yep.
Are there any other side effects from the shingles too that have developed when you've gotten that double shot of shingles?
Yeah.
Are there any other side effects?
Other than those initial side effects, I really have not heard reports of any very common long-term side effects from the shingles vaccine. No. Guillain-Barré, I'm not sure that, I don't know if I know any data related to that. That's more like with RSV vaccine, they were seeing some increased risk, or flu vaccine, but it mentions Guillain-Barré. Okay. Well, I will be honest and say I don't know, but I would say I'm very confident that risk would be far, far less than your risk of a severe case of shingles. So, yeah. That's, yeah.
It still can't even swallow. The only thing it's eyes.
Yeah, and Guillain-Barré is a serious illness. Yeah, but Guillain-Barré is something that people get all the time. So how do you know if it's from a vaccine or not? That's where you have to look at data that says, well, people who got the vaccine you're going to see more cases in of people who don't get the vaccine, and then you're weighing those pros and cons. But I'm not sure that I've seen any data to suggest that shingles increases your risk for that. But lots of things can lead to Guillain-Barré, and it's an autoimmune disease, so things that can activate your immune system. Typically, and why you see it sometimes following certain vaccines, is because it's similar to getting an infection, right? We're trying to trick your body into thinking that you have this virus or this bacteria. And flu is a very common cause of Guillain-Barré, people who have influenza. So it's not surprising that you might see increased rates related to the vaccine, because the getting influenza itself is one of the biggest risks of having this autoimmune reaction to the infection, to the virus. Hepatitis. Anyone heard of hepatitis? All the hepatitis A, B you have? Anyone know about hepatitis A vaccine? That's a little bit newer as far as the recommendations. Hepatitis A we give now at 1 and 2 years of age to babies. Hepatitis A is hepatitis B and C are kind of bloodborne. You get it from blood exposure or bodily fluids. Hepatitis A you can get from contaminated foods or person-to-person, kind of hand-to-mouth sort of things. There's been outbreaks from frozen strawberries or in different areas or different towns. There's still high rates of hepatitis A in a lot of developing countries where sanitation isn't as assured as it is in the developed world. So again, it's routinely given to kids, but most of us didn't. Well, none of us got it as children. It's out there, and any adult who wants protection against it can get it. Why would you want it at this age? Well, I think, I don't think you're going to get I think you can get it from contaminated food that, again, we've seen our global supply. There was outbreak from tropical smoothies that got frozen strawberries. For the smoothie that you got in the drive-through, I don't know if you have one here, but we have one in Petoskey. But those strawberries came from Egypt because that's our food supply is global now. And that was years ago. I'm not saying you should or shouldn't go to tropical smoothie. That was just an example. But the other big reason is if you travel. People who go on mission trips or going with their church to Haiti or to Africa, or they're going to Central America, or they're doing a big trip where they're going to be in developing parts of the world. You don't want to wait until I'm leaving next week. You need the vaccine time to work, and it's 2 doses 6 months apart. It lasts a lifetime. So if you're someone who likes to travel or thinks about travel, or you're talking about going on a volunteering somewhere, this is what you want to get. You want to do this now rather than wait until right before, because it's kind of too late at that point. Hepatitis B vaccine, again, we give to all, it's part of the routine childhood immunization schedule. The new recommendations actually say that any adult up to 59 years of age can get this. If they haven't, it's routinely recommended. That said, I think for most of us, the risk is pretty low. Who's at risk for this? Well, healthcare workers, people that might come into contact with dirty or contaminated needles or blood products, someone who injects drugs, people who have to check if they're having to use lancets and they're always checking their blood glucose, and there could be contamination from that. They're at a little higher risk, or people with underlying liver disease certainly should get it, but that's routinely recommended. Again, in this country, fairly low risk to most adults. HPV, I'm not going to talk about this that much. Just looking at the crowd I'm talking about, this is a great vaccine because it's human papillomavirus vaccine. This is one that is used to prevent cancer. And hepatitis B as well prevents cancer of the liver. HPV vaccine prevents cancer of the cervix, cancer of the anal cancer, vulvar cancer, cancer of the back of the throat, pharyngeal, and the papillomas that you can get back there. So it's really amazing. It's extremely effective. It's a virus that is very common, very easily spread. All of us were exposed to at least, there's several strains, we're exposed to at least one strain growing up. And by the time we're in our early 20s, most all of us have evidence that we've been infected with at least one strain of this. Most of us clear this infection. We never know we have it. We don't get any symptoms, but we can shed it for many months and spread it to other people. And that's the main reason why women would have abnormal pap smears and abnormalities that would lead to biopsies that would lead to needing treatment for cervical cancer or changes in the cervix, or again, cancers of the oral pharynx as well. But this one is just the oldest. We don't give it over age 45. So for older adults, if you're over 45, it is not licensed and not one for you to have to worry about. M.P.H, monkeypox, you heard about the monkeypox. Haven't had too much going on there, but there is a vaccine for that, so I just mentioned it. That is still out there, and we still have it. We don't stock it, but we can get it if individuals need it. For primarily right now, the outbreak has been related to men who have sex with men, but it's not transmitted sexually. It's transmitted by close contact, close skin-to-skin contact. If someone in your household had monkeypox, you would be at risk of getting monkeypox because you're living, I'm assuming if you're, a household and you're related and you're close and you hug and you do things together, you would be at risk, and you can also get this, you could get this vaccine as well. So it is out there and available. We gave very few doses in Northern Michigan, but it is there. And for people who need it, it would really be strongly recommended. Healthcare workers, I just put this up there because again, and you can go to CDC's website and you can look at recommended adult immunization schedules. And again, they do it by different health conditions. If you're pregnant, they have ones that you should consider. The ones in the red is like, oh, you better not get that one if you're pregnant because it's contraindicated. And then, healthcare personnel. And I say that because if any of you people who do a lot of volunteering in hospitals or other healthcare systems, I think it's also something to talk about things like, MMR, measles, mumps, rubella, chickenpox vaccine, hepatitis B, tetanus, and Tdap, which is pertussis, influenza. I must have skipped over. Oh no, here it is. So measles. I'm thinking a lot of you probably maybe even had measles. I never had measles. I had the MMR vaccine because they started using it in the 60s. If you were born in the 40s or 50s, you probably had measles. It's so contagious. But someone like me, I only had one dose. So when I started medical school, I got a second dose because you really should have 2 doses to assure immunity. If I was going to have someone volunteer or if you came to work at the health department, I would look, and if you had your immunization record and you only had 1 dose, I'd give you a second dose. If you couldn't remember, maybe I would check and see what your antibody titers were. But adults can get MMR vaccine. Again, if you were born before 1957 and you're not a healthcare worker, we figure you probably had measles even if you don't remember it. But MMR also protects against mumps and rubella. Hib vaccine, I mentioned this one. This is one we give babies. Hib's a bacteria that causes meningitis and was a leading cause of deafness. The vaccine is almost eliminated Haemophilus influenza B disease, but adults, if anyone is going to have their spleen removed, and there's actually, if I go back to the slide, because sometimes older adults, you end up needing your spleen taken out. Oops, I don't know what I did with that. That's where I missed that one. But if you're going to have your spleen removed, I'm sorry, I'm just that one. If you're going to have your spleen removed, because sometimes you have certain underlying health conditions, and you hear about people getting splenectomies, that puts you at really high risk of meningococcal disease and Hib disease, and you really want to get vaccinated with those. In fact, if it's scheduled, they try to get you vaccinated beforehand. Usually your doctor will tell you about that, and we do that at the health department, not all the time, but not uncommonly. I wanted to mention tetanus shots that probably everyone knows. You're supposed to get a tetanus shot every 10 years, right? And if you have a dirty wound and you get cut with a rusty saw blade, you go in, maybe if it's been 5 years, and you get another tetanus booster. But Tdap is, the P is pertussis, or whooping cough. And this is routinely given at 11 to 12 years of age. And really now it's given every 10 years, but I don't know if people remember when you last had a tetanus shot. Sometimes we forget. You probably got a Tdap if it was in the last 5 or 10 years. But another reason why it's important for adults to get this is because whooping cough, if you and I get whooping cough, we might have a cough for 2 months or 3 months. In China, it's called the 100-day cough. And it wouldn't be fun. People cough so much they can crack ribs, but it generally won't kill you. Who we worry about are babies, especially babies under 2 months of age. They're the ones who really can suffer with pertussis or whooping cough. So we recommend all pregnant women get the Tdap vaccine during that 3rd trimester. The mom makes antibody against pertussis, travels across the placenta, and when that baby's born, for those first 2 months, they have much lower risk of getting pertussis as a baby. More than 3 out of 4 are prevented if you do that. And then in addition to that, we like to protect, we like to make sure everyone else around that baby. So if you have a grandchild who maybe mom's expecting, you have a child or expecting another child, you're going to have a newborn that you're going to be helping take care of or wanting to visit, I'd make sure you're up to date with your Tdap, because I don't think any of us would want to give pertussis to our loved one. So I'm going to think, oh, there we are. Now we're at, really, I'm going to get into traveler immunizations. How are we doing for time? We okay? Okay. So is that something, are people interested about traveler immunizations? Okay. Well, it's hard. We used to have a travel clinic, the infectious disease doctors in Petoskey did it. They don't do it anymore. There was one at Munson that was in Traverse City, which it doesn't really help you guys, that it was off for a while because of all the, just changes. There's not as many specialists anymore in that specialty up here. There are travel clinics where you can meet with a doctor or a provider, a nurse practitioner, but you have to travel a bit. The closest one to here is Midland. The Midland County Health Department, I guess, there's lots of good ones. There's private ones. The health department, I think they do a very good job. I've heard they provide all the travel vaccines you need, but they'll also provide you guidance. But really the neat thing is if you're traveling somewhere, if you go to cdc.gov/travel, they have an amazing, it's one of their better websites. You can plug in where you're going and it's going to give you all sorts of recommendations, not just what shots you need, but what other things, you should do to protect yourself when you're traveling. But for some travel, one thing, you can kind of divide it. Do I think you should get one or do you have to get one? There's certain countries where you must have yellow fever or they won't let you in. So you have to get shot if you want to visit there. It's just part of the deal. There are places, if you're going to Saudi Arabia, to Mecca for the Hajj, they require that you get the meningococcal vaccine. If you don't get the vaccine, you can't get off the plane. So those are required. Otherwise, they're mostly just recommended. Yep. Yeah. It depends. If you're just a visitor, I don't believe so. No, they do when people are coming in as like refugee assessments or people who are coming in to live here. We do assessments, and they generally do require some vaccines. Yep. Yeah.
My second question is, I know the Bill and Melinda Gates Foundation had a lot of success with polio.
Yeah.
Eradicating it, but then I saw a documentary where it said there were still pockets of it in war-torn countries.
Mm-hmm.
Because of that, it's hard to get in there and leave it eradicated. How?
Yeah. Yeah, polio was eradicated from the Western Hemisphere. Certainly, I would love to see it eradicated in my lifetime. It is not fully eradicated. There is still some pockets of wild polio circulation. Because of that, that brings it up. You know, they did recently, this is a recent change. Most of us had polio vaccine as a child. We're going to assume, unless you know for sure you never had it, we're going to assume that you had the polio vaccine. So we don't recommend that you don't need a polio booster unless if you are traveling to an area where there is endemic, meaning they have polio circulating in that area, they're going to recommend that you get one time a polio booster, a polio shot. It's inactivated. So we have had a few people that have come into the health department because they were traveling to an area and they needed a single polio booster. Where is that? What are the areas? Those change over time. So I'm not going to say it's this country and not that country. I'm going to tell you to go to cdc.gov/travel, and they will show you, they're going to give you what the current recommendations are. Yes?
So if you're going to travel, so we're talking about hepatitis A.
Mm-hmm.
So if you're going to travel before that 6 months, so would you recommend you at least the first one or just?
For hepatitis A? Yeah, I would. Yep, I would tell you, even if it's been, because that one dose is going to give you some protection. So even if you're leaving, if you're going away for 2 months and you're leaving next week, I'd say you can get the hepatitis A vaccine now. You're going to be unprotected. You know, it takes a few weeks. So that first week you won't have protection, but if you're going to be there a while, it will give you some protection. Yep. I know 6 months. So you get it when you come back and complete it, and then you're good for your next trip. Yep. Typhoid, there's a vaccine for typhoid. Typhoid is mostly, well, you can see the countries that are shaded there. It's a salmonella bacteria, the typhoid Mary that we all heard about. It's obtained, you get it through contamination, fecal oral contamination of food and water. Mostly it is in Asia. That's where it's most common, is in Southeast Asia. So you're going to Laos or Thailand or Vietnam. You're not staying in the five-star hotel in Bangkok. You like to travel and get out into those small villages. Maybe you like to sample the foods that are being on the street foods or vendors. Or again, maybe you're doing a mission trip or a church-based trip or something else where you're volunteering and you really are spending more time with the locals, so to speak. Really would be a good idea. There is still some, they will tell you to get this vaccine if you're going to South America or Central America, but it's a much smaller risk, but still an increased risk, and no reason if you want that protection that you can't get it. And again, that's something like the health department doesn't stock that vaccine, but you can get it from travel clinics. Yellow fever, talked about that a little bit. You get yellow fever from mosquitoes. So number one, if you're traveling, I always recommend, taking precautions to prevent mosquito bites, because that'll protect you not just against yellow fever, but dengue fever, and chikungunya and Zika and all sorts, and malaria. And we don't have vaccines against those, but yellow fever we do. Very serious illness if you get it. Those are the countries where it's prevalent and where you really need to think about taking precautions. It's also based somewhat on where you're going. Again, what kind of travel are you? You're staying in nice hotels with air conditioning, where you don't have to worry about mosquitoes when you're sleeping, or you're staying at high elevation where there aren't risk of yellow fever, Machu Picchu or something, versus staying down in the more lower elevation areas. But yellow fever, serious, and again, some countries do require it. This was as of when I wrote this. I just said, these are the countries that require it. Many other countries, because they don't want you bringing yellow fever into their country, they've eradicated it from their country. So if you were in a region with yellow fever, if you had a layover in an airport in a country where there's yellow fever, and then you went to their country, they're going to make you have it. Again, that's where you need to just look up the resources. But all of those countries, so quite a few, they actually require it if you want to enter it. I think the other thing I like to mention with travel is most things that'll get you sick traveling, we don't have a vaccine for. Clearly, malaria is a whole different issue. I didn't talk about that. If you're going to an area where there's a lot of malaria, depending on how long you're going to be there, you should think about taking malaria prophylaxis, where you have to take medications, but you have to start before you leave. You got to take it after you leave. So when I have people, relatives and friends who ask me, I'm like, you're going to be there for a week and you're going to use insect repellent and you're staying in places that have air conditioning again, or they have screens on the windows. I wouldn't bother. I would risk it. But everyone's different. If you can't tolerate risk, then go get a prescription and take the medicine. But if you're going to be there a long time, or I have a sister who loves to do more adventurous travel, and they're staying in huts and doing homestays where they're on a mat on the porch, and you want your, she's taking her malaria prophylaxis because the risk is real. But it's not just, again, malaria, a lot of dengue. I have a coworker who was in South America, came back with dengue fever, was absolutely miserable for a few weeks, was lucky that she didn't develop the complications from that. She got over it, but can be very serious. And then the most important thing, I think, really when you're traveling is making sure, trying to think about the food you're eating and the water you're drinking. Those are the most common reasons people get sick when they travel, is from contaminated food or water. Fruits and vegetables and foods, you either got to cook it, peel it, wash it, or just forget it. That's traveler's diarrhea being by far the most common thing you can do. And again, there's a lot of good advice for travelers on that CDC website. Yeah. Uh-huh.
So how would you know whether it's required or just regular?
I think it's going to tell you what they're going to give you recommendations. The only ones that are required that I can think of offhand are the yellow fever, and it will tell you if that country requires it. It should. You may have to go to like the yellow fever website. Within their travel site, go to yellow fever, and then again for meningococcal, that's generally just people traveling to the Hajj where it's required. Saudi Arabia requires it. So if you're going to Saudi Arabia, that would be something to think about. Otherwise, meningitis is recommended but not required. If you're going to that meningitis belt in Africa, there was a slide on that I could show you, but those aren't required. They're just, and it's also seasonal. Again, when are you going? Where are you going? What sort of travel? You're going on a 5-star safari, less likely that you're at risk. But again, people who are going to be there for a longer period of time, who are traveling into that orange area there, they recommend it. Again, where it's required, the only one I know is if they're traveling to Mecca for the annual Hajj. That's the only one that I know of where it's required.
They're not.
I don't know if any countries still require vaccines, COVID vaccine for entry. That I don't know. As far as I know, most countries have, that's gone by the wayside because again, all of us have some immunity to COVID. We're in a different place as a country and as a world and as people than we were, in 2021.
The things that I have a problem with is when I get my vaccinations at the health department, they keep a really good record.
Yeah.
My doctor, oh my gosh, they just seem to lose it.
Uh-huh.
And they were real good with the health.
Uh-huh.
They said, if you can have them give it to us, we'll put it into your official record.
Yeah. Well, it's like I've planted you because my last slide, I was going to skip over it, but MICR, it was the immunization registry that was started. A lot of states have them. And they were started, it was called the Michigan Childhood Immunization Registry. Now it's called the Michigan Care Improvement Registry. If you give an immunization to a child, you must put that immunization within 72 hours into the registry, unless if the parents don't want that going to the government, they can opt out. So there is an opt. But most kids and most records go in there. Adults, your doctor does not have to put it into that portal, but we recommend that they do. What really the issue, everything's electronic now. And we used to have to literally, and we still do sometimes have to enter it into our one system and then enter it into this MICR separately, which is just silly. More and more, they're trying to get your doctor's immunization, your doctor's health records, their computer, to talk to MICR to send that information over. But you know, there's things that have to be done to make sure it's secure and confidential and everything else. But MICR is a state registry, and what's needed, there is actually, you can get a patient portal. You can go in there and prove that you're you, and you can get whatever is in there for you, and it's your shot record. The health department puts everything into MICR. The drugstores were better at it because the chains, because they're big, massive companies, they could invest in the software and they got them online. So you get your flu shot at you know, Walmart or Walgreens or wherever, it should be in MICR. And your doctor may or may not have it in MICR. I would like it if more of them did. If you want it in there and you have a paper record from the doctor, our health department will put it in there for you. And what's nice about that is if you moved to Florida, you could go into your patient portal and look it up and print it out, and you could give it to your doctor in Florida. Here's my immunization record. Or if you just want to know what you need, you can print it out. You switch doctors, whatever. You know, it's your information and you'd be able to have it. It would be great. I'm going to tell you, not every shot you got is going to be in there. And this hasn't been in, I mean, my childhood immunizations aren't in there because we didn't have computers in the 60s and 70s, but the shots that you've gotten recently are in there. And that's a good place to go. So if you get something at the health department, they can always give it to you, but you could actually find it yourself on the portal. And that's the end of my presentation. Yes.
I just during COVID, I worked in a school and relied on your website, and it was up to date.
Yeah. Well, thank you. It was a challenge, right? Because up to date lasted about a day or whatnot, but it was a challenge. It was something, you know, I hope we never have to go through again. I certainly never will from a health, I will not be working at the next one way or the other, but it was a challenge, and we had a lot of staff who really worked really hard and did the best they could. We're all human. You know, we know lots of mistakes were made during the pandemic, but I think as a community, we came together here and did what we needed to do to try to keep people as safe as we could. Other questions? Yes.
Remember, in an obituary from years and years and years ago, I think my mother must have saved it. What is consumption? Dies from consumption.
Yeah, often tuberculosis. Yeah, because they would lose weight and just get consumed, and it would take a long time. So I'm pretty sure they were probably talking about tuberculosis, which was a leading cause of death until we had anti-tuberculous drugs and everything else. And you may not know it. People have heard about bovine TB. You are actually in the only area in the country where we have endemic bovine tuberculosis in our wildlife, in our deer. And unfortunately, we have had individuals who've become sick somehow through contact with deer or cattle and had tuberculosis, but bovine tuberculosis. So you're a unique spot in the country, for better or for worse.
Depends as far as how many kindergartners are getting vaccinated coming into school.
Yeah, they have gone down for sure, and it is concerning. The waiver rates have gone up, and that is something that's very concerning to me. I think we really do need to work on that to try to improve our messaging, because you know, and even, you know, getting past COVID, you know, it doesn't matter what you might think about the COVID vaccine or how it was handled. Just forget all about that. And just these vaccines, we've been used for so long. And the last thing we need is to have measles come back and have measles, you know, and all of these other childhood scourges around when we had done such a good job. You need to keep, you know, that immunity levels high enough to prevent outbreaks. And we're kind of at the precipice there. And it worries me for sure. Yep. Other questions? Yes.
How far apart should you space your vaccinations? Like right now, listening to your presentation, I need 3 vaccinations.
Oh, yeah. You can get them, well, depending on what they are, but often you can get them all at the same time. Yeah. 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 Well, sometimes you can tell based on what the reaction is, or if it's a local reaction, which arm you got it. So I think it somewhat depends what you're getting, but I would like, you're getting flu, you need flu and pneumonia and RSV, you could do all of those at the same time. Could you separate if you, there's no recommendation to separate them. I couldn't give you, the data suggests to wait 2 weeks or 6 weeks or 8 weeks. There isn't one. If you're just not comfortable and you want to get over one fully, then you want to wait 2 or 4 weeks. You can do that. I'm not recommending that, but you can. My wife got flu, COVID, and shingles at the same time. Yeah, she was miserable for a couple of days, but I think she was going to be miserable for a couple of days after that Shingrix, if, you know, because, you know, so just, she just got it done. She's tougher than I am. So, yeah. And I think because the immune system can handle it, your immune system responds. There's no data that suggests it reduces the immune response, which would be concerning. And if there was, and in fact, there's some childhood immunizations that they don't necessarily play together well. And they say you shouldn't do those two at the same time because they have data that you don't respond as well. And if they had data like that, I'd say, well, then you want to wait, because if you're going to get it, you want your biggest boost, right? But we don't have anything to suggest that's a problem. Mm-hmm. Yeah. That, again, those, you know, that timing issue, I don't have data for you. So I don't think there's any clear recommendation. You know, right now we don't have an updated COVID vaccine. I mean, I know they're working on one, but it has not been put out yet. I haven't seen recommendations, so I can't really recommend much at all for you right now, but I'm anticipating that there will be an updated COVID vaccine, and I'd recommend that you get it this fall. The flu vaccine is simple. The flu is, we have a lot more data, and I'd say when it comes out, you want to get it September, October, you know, when it's convenient for you at the health department or the drugstore, your doctor, or wherever you go. You know, if you have a physical schedule, then you always get it then, and it's October, that's fine. People are like, well, I want to get it before I leave to Florida because I don't want to deal with it in Florida. Okay, then get it earlier. If you maybe you have a huge trip planned in you know, or a wedding to be at or something in January and February, you're going on some big something. You want to wait to get the COVID vaccine until December to get your biggest, you know, to really reduce your risk of getting COVID when you're on vacation, because that would kill you, right? Or it would, you know, you really don't want to get sick on this. You spend all this money on this vacation. I can understand that you might get COVID before then, and then you're like, oh, I should have gotten the vaccine beforehand. It's a risk benefit thing, but I can understand your thinking. If you're like, I'd rather have my protection then, because we know COVID vaccine doesn't last that long. So that's where I don't know what your plans are. So I wouldn't, it's hard to, that's a timing game. It's kind of gambling, and I don't have I can't really give you an answer there. Yeah. Yeah, you want to get protected before you do that. Yeah, so, right. So for you, then I might say, well, and you know, a couple weeks, at least 2 weeks before then, get yourself your immunizations, because you need 2 weeks. And that might make sense for you. Other people might want to wait later. Yeah. Okay. Anything else? Anything? No? You're welcome.